Well, I wonder if we can maybe just wait another couple of minutes. She always just knows exactly when to arrive. And
yep, and I think we still have people joining us, so I think that's just fine. Yeah, we'll give it another minute or two.
Wait. And we do have an agenda for the meeting, and just give you an idea of the agenda. So we'll do the update with Doris and myself, and certainly Heather, checking the pulse again for a period.
And I think we've got some specific questions about that we'd like to ask. Yep, so we can maybe start with that. Yep.
I was thinking that myself, and then we want to do the round table sharing. And as we've been working on the webinar together, we've really noticed some fabulous cross team sharing, which is what this is all about: learning from each other, supporting each other, and taking back good ideas to your own workplaces. I already shared the upcoming webinar. And then, of course, remember, Thursday we'll be gathering again at 5:30 with this group. Okay, so maybe the checking the pulse slide. Yeah, Heather, maybe take us through these questions and the source of them and what we're looking for.
Yep, so we've obviously, with the new directives from the ministry as of last week, a large number of them directed towards long-term care, sort of the night of the 15th into early morning of the 16th. And certainly, you know, a need for increased testing, along with obviously enhancing the staffing in long-term care and other interventions. And obviously, the limitation of staff going from one home, having one home only that they're working in. But we wanted to check in with you about testing, because that was something that we heard from you in our previous calls, that you were concerned about either the lack of testing or having supplies for testing or being able to access testing results. So we've got these questions on the screen, and we'd be very happy to hear from any of you who would like to respond to any of these comments. And we've just had about 6 people join us in the last minute. So I'm going to just put these on the table. I'm not going to go around the table at this point. Let's just see if anybody has any comments that they'd like to share about sort of your testing processes currently. And of course, this is for residents and staff. Are you finding any challenges with getting equipment and supplies for the testing? And are you getting the results back yourself directly, and how are you dealing with that? So those are the questions that we'd like to put forward to get us started. So I'll stop talking now and see who'd like to step forward to answer that.
And feel free to use your chat box or unmute yourself.
Oh, great. And Doris has just joined us. So Doris, we were just starting with some initial questions. We've got about 26 people on the line.
26 people.
Yeah.
Lovely.
And so we were just getting started with checking the pulse about testing, because that was a big key question last week, and obviously some new directives since we last met. But we haven't started yet, so maybe you'd like to give us a bit of an update about what you've been dealing with.
Yes, an update on testing, several updates on testing. So long-term care is a priority for testing. However, there is not enough testing, so here you go. The priority likely will come 2-3 weeks from now, in terms of really being able to enact it in a more surveillance way. What I am concerned, and this is why I am late actually, is because a family doc called me about a nursing home, and this is the second that he hears about this, that someone died. They believe the person died from COVID, but no one in the homes has been tested, even not the person that died, because the home doesn't want bad press. So my question goes first to my colleagues, my 26 colleagues in the phone. I want to hear that people in your homes at least are being tested when there are symptoms. Can I get yeses or nos in your screen, and you tell me what's the answer?
Yeah, so if you could respond in the chat box, just yes or no.
Yeah.
testing with symptoms.
Yeah, okay, we've got a couple of yeses.
Yep.
Yes. No, Doris, so far, all yeses.
Oh, okay.
And then there's some people are testing for symptoms atypical as well.
That's good. Okay, amen. So I said to this physician that I had not heard, but here you go, that I was going to test. So that's good news. So in our view, the more testing you can do, okay, the better it is. Of course, if there is someone that is suspected, you need to, you know the rest. You guys know better than me, okay? I don't need to go through that. But there will be more testing available, okay? But that will come likely end of April, beginning of May. Yeah. And then there is a question about supplies. We spoke about that. Are you receiving testing results? That's the question for you guys.
Yeah, so this is a follow-up question, like, are you receiving timely enough results? Because we've heard some people are waiting weeks for, or not weeks maybe, but at least a week for results. But also, when we had talked last time, there were some challenges about getting the results, period. So just wanting to get a sense from the group on the line, how that receiving of the results is going.
48 hours, that's good.
Yeah.
Yeah. And someone said no issues with supplies.
Public health is providing the testing kits.
Yes.
Claudia is saying it's a few days now for the results. Jean's saying that the results go to the lead of the infection control, other than ourselves.
Turnaround's been varied for the tests, but generally, Shannon, what is the time range?
And you're welcome to take yourself off mute, Shannon, if you can, to respond to that, or just put it in the chat.
No issues with supplies.
Yeah.
Supplies has improved, that's good.
Yeah. Hello.
Hi, Linda, go ahead.
Hi. I wanted to address this only because my nursing home is in a respiratory outbreak. We have had no COVID residents, although we did have one death. So the good part is that resident was tested, that expired, so that was good. The unfortunate part is I got sick, so if you can't hear it, I am.
Yeah, we can hear you.
Yes. So the testing part, I think for the residents is going well. I am concerned about the employees getting tested and the expediency of that and the availability of test kits and where they're being tested. So I was off as of last Wednesday morning. I didn't get tested till it took 5 phone calls for me to make arrangements to get tested, which didn't happen till Friday afternoon. And I had to drive an hour to go to the testing site because it doesn't occur at the hospital, the closest hospital anymore, because they have COVID testing centers. As well, what is this, Monday? I'm losing track of time here, but Monday, and I still have no results from my test from Friday.
Okay.
So that's been my experience. I find that, you know, that you have to go off site for the testing really doesn't seem to be a logical thing. If we've got test kits there, I don't know why we can't just do it on site for the employees if they're unwell before they leave or go home.
Yeah, that's actually a very good point. So, is it okay if you send me a quick note on that?
Sure.
Yeah. And
Yeah.
do you want me to include your name in the question or without name? I'm okay either way.
You can include my name, that's fine.
Okay, good. I will put that in my report. Today, I'm actually talking about data and data access. This is part of it.
No problem.
Yes.
And I think too, this maybe links back to one of the questions we had last week around being able to access results. So depending on who's doing the testing and knowing what the status of the staff are, and where the tests are actually taken, because some staff don't necessarily live in the area where their long-term care home is. So in terms of being able to report outbreaks, you might have positive staff that live in a different region but aren't counted in that outbreak for the home. So these are all kind of interconnected pieces that we need to kind of think about.
Yeah, well, and that's very important because not only is about the home, but the community where the staff goes back
That's right.
in terms of case and contact tracing. So it's case and contact tracing with the home and also with a totally different community. Very good point.
Yeah.
So we've got a
So
lot of comments in the chat.
Joanne,
Go ahead.
yeah. Do you want to, Joanne from Haileybury has said we opted not to test our own staff as we did not want them to come to the home. We sent them to a designated testing center. There has been same day testing. I am from Northern Ontario. Well, that's good. We're same day testing. I don't know when do they get the results, Joanne? Is it quick as well?
Within 48 hours, I was told, except for the weekend, of course, but it was pretty rapid.
Okay. And so that is a good point. If you don't want your staff to have to come back to the home if they have the symptoms. Yeah. What
No,
about
but if they
others?
have, but imagine by the same token, if they have symptoms before they leave,
Yes, exactly. Yeah,
be
yeah.
tested there rather than send them an
And
hour
have them-
away.
yeah,
Yeah.
no, I agree. Yes. What about the rest? Are you testing staff? How is staff testing occurring? Don't have anybody.
We've got a comment from Jean that she's saying that they've also had a respiratory outbreak as well, which I'm assuming is not COVID. All testing so
No.
far has been negative for influenza A, B, and COVID-19, which is great to hear.
Fantastic, yeah. Okay, well, we're not getting a lot of responses. Okay, we've tested one staff related to her dad having symptoms. That was on site, right, Christy? At your site? Yes. Mhm. Okay. Maybe others aren't
Okay,
testing,
Sounds
yeah. So
good.
maybe we can, yeah, external testing sites have been used for our staff. Yeah. Okay, so it's mainly sent to assessment sites for testing. Definitely more are being tested. So more are using the external, I would think. Yeah, sounds like it.
I think that the request should be that they need to use what's most convenient for the staff and
Yeah.
to shorten the period of being out and about.
Mm-hmm. Yes, what works best. I mean, no, you don't want to have to come back to the site. You can go elsewhere, but why go home only to come back somewhere to be tested? You're right.
Yeah.
So do we want to do anything more with these checking the pulse questions or go back, Doris, for some of your other update comments?
Up to the group. Are there any other urgent questions?
In terms of checking the pulse here.
Yeah, in terms of any issues that have come up since last Thursday to today.
Okay, well then
Any
why don't
issues?
we do a round table then?
I
You wanna
think
do
so,
that?
just in case,
Okay.
because that allows us to be on top of supporting people. I have been with a few of you also online, asking if there is anything else we need to do. So it seems things are a bit more stable, it seems. Not that there are no outbreaks, but
So just to remind everybody that we did have an opportunity last week to talk to Wendy, who was going to provide some updates for Doris, which she's done and is available for media discussions.
not yet, not
But-
yet.
no, but when the
Unfortunately,
time
not
comes.
yet, because what happened is she was going to be clear up in the house, but two staff tested positive.
Okay,
So
all right.
now it's
Oh,
10
shoot.
more days, 10 more days.
Okay.
Oh,
So,
Fair
but
enough.
then so for this goes for any of you that wants to be in the media, forget outbreak or not. If any of you that works directly in a nursing home wants to serve the nursing profession, because that really is what it is, by speaking to the media either on how you prepared and how well it went, or on an outbreak and how did you tackle it, or we now are off the outbreak and here you go, things are better and people are, you know, anything, or on human resources, on anything, of course, with the permission of your home. Please do let us know, because we would be thrilled to profile you. We will be thrilled to profile your home. So yeah, Wendy's one of them, and she's ready and she got the okay, and we will do that. And I will be using her piece likely on Thursday already, because tomorrow I'm doing, I think, on mental health and addictions, but Thursday or the other way around, depends. But this week I will be using her piece, and I will be doing a whole expose again on long-term care and what's happening and what needs to happen next. So if any of you wants to send another piece for it, by all means, there is space.
Okay, super. So would you like me to go around the table and just see if people have comments?
Yes.
Yeah. Okay, so we'll start with Christy Thompson, and I'm not sure if Christy can take herself off. Oh, she's got a message ready to go here. She had a team from Ottawa contact me to tell me they are available for support if we end up in outbreak. Thought that was really great, and hopefully we won't need them.
That's fantastic.
That's super. So being proactive there. Beth Sweeney, anything
So
from you?
the team from Ottawa, from where?
Christy, are you able to just either take yourself off mute
Is
or
that through Via Nurse, or is that through Ottawa Public Health Unit, or what?
team from
Ottawa
Ottawa, Ottawa Hospital? Yeah.
Okay, good. Yes, because what happens is that they're not as full as they expected. They're only at 80% capacity, so they have a lot of people so that brings me to the issue that some of you have written to me, can I work in more than one place? Well, in the case of hospitals, they can work in two places. So Heather, that goes to you too for some questions that have come to us.
Yeah, I've seen it. Yeah,
They
I've
can work
responded.
in
Yeah.
more than two places.
Yeah.
And in the case of NPs that work with nursing homes, one place physical, the other virtual.
Okay, and Beth says she doesn't have any specific questions right now. Cindy, Cindy, do you have anything that you'd like to bring forward or ask about?
Hello.
Hi, go ahead, Cindy.
Hi, I'm okay. Thank you.
Okay, super.
Thanks.
Okay, Claudia, anything from you?
So maybe Heather, in addition to if they have questions, outbreak or not in their home, please. Just to get a good pulse.
I'm sorry,
on it.
Doris, it kind of cut out there.
Yeah,
You kind of cut out there for a moment. I'm sorry, I missed that.
Yeah, whoever is speaking at the time, if they have an active outbreak or if they have an outbreak that is resolved or if they have no outbreak, please. So I don't know about Cindy.
Okay,
Well,
yep. We can.
Was that Cindy or Claudia?
So Claudia is asking about waterproof gowns and access to the same.
Same situation that with all the rest of the PPEs. You go through the Ontario Health Regional, the lead PPE, and Heather maybe to send it again with Kyle.
Yep.
And if you have issues that you cannot have enough, then you escalate it to me.
Okay. And Chrisita, do you have anything that you'd like to ask or comment on today? And again,
Thank
just
you.
if you're in outbreak or not.
Thank you very much. No comment today, thanks.
And no outbreak?
No.
Or yes.
No.
That's fantastic. How big is your home, Cindy,
Okay.
Christy?
Chrisita, how big is your home?
I'm actually not working at a home. I work in the community, but not at a home.
I remember you work with long-term care clients, but from the
That's right.
community,
That's
right?
correct.
Yes, yes.
Yes.
And how is your situation working? Because last time you asked the question about testing and getting the results, were you able to
So
work that
I
out?
was able, yeah. So what the situation is because I'm working as a contractor, it's sometimes makes it difficult to interact. So if I have to go usually I would escort patients to appointments. But now with the lockdown, that's hard to do. So people, I've been sort of doing this online. So I'm not actively on a site consistently.
Okay.
Yeah.
Good. Thank you.
Okay,
But
that
it's hard
helps to clarify.
because of what I do, because of how I'm working. It's hard to get that support because I'm by myself in essence.
Okay, well, raise your issues and comments here, Chrisita, and
Yeah,
the group and all of us will help as much as we can.
These meetings have been excellent.
Oh, good.
Good.
Yeah.
Good.
Thank you
That's
so
good
much.
to hear.
When people are writing respiratory outbreak, no COVID, is because you tested some of the residents and you know that actually there is no COVID, or how do you know?
Me?
No,
Corsita?
anybody. I see a lot of no outbreak, but
Mhm.
yes, respiratory outbreak. So I'm asking everybody. All the residents are tested. Very good. That's Jean.
Okay, Linda, is that what you meant too? You say respiratory outbreak, no COVID, except.
Yeah, yes.
Okay.
It was, but just so you know that we're not testing asymptomatic residents. We're still testing only the people that, either spike a fever or have respiratory symptoms, and that's how they're working it. So we've probably
No,
done.
but when you say respiratory outbreak, it
Yes.
means a lot of residents, right?
Oh, yes.
You test all of them?
All the ones that were symptomatic and everybody we put in isolation.
Okay.
Okay.
And all of them have been negative?
Yes, correct. For the COVID, no, influenza A, B, and it was HMPV.
Wow.
Great.
That's
Yeah.
good. Yeah. So someone's
we've got a lot of-
asking about, oh, sorry, Heather.
No, you go ahead, Imogene. Thank you so
I
much
was
for helping
gonna
with the
say,
chat.
someone's asking about suctioning and should deep suctioning be done? There's comments about deep suctioning because the risk for aerosolizing. Any comments from others on that? I don't know where this started. Did someone have a question about deep suctioning?
Yeah, there was a question there about suctioning palliative care patients.
Okay.
So I would assume that it's the same as always for palliative care patients. I would like my colleagues on the line to speak about your experience with suctioning palliative care patients in general, and then if you do anything different with COVID patients. I would assume that your protection is more serious, right? Can
Hi,
anyone?
this is Jean. The standard of care is no suctioning, even in the regular palliative
No
and-
suctioning at all.
end of life. No,
End of life,
and particularly the question I know is about deep suctioning in case a person gets full up. And the risk with the COVID is it's an aerosolization of the virus. So definitely no. And no fans either for breathlessness.
So,
because we do use fans when we have, say, somebody dying of advanced COPD, because there is evidence that if you can get the airflow over the trigeminal nerve, it gives a relief to the person. But that is one of the no-nos in the COVID infected person.
but wouldn't, if you were to wear the right PPE, like in ICUs, they're suctioning patients. If you were to use, like I'm thinking about the patient and choking, right? So how do you deal with that?
Well, I mean, first and foremost, we have to differentiate whether the congestion is at the base of the throat from the saliva. So we use the two medications, scopolamine and glycopyrrolate. Just for your information, glycopyrrolate is on almost back order at the present. They're hoping scopolamine is going to. If the congestion is further down in the lungs, which can happen with the COVID process, is the recommendation is to administer furosemide and to stay away from any interventions that are carry that risk potential for aerosolization. I can send a link to an excellent webinar that was given out of Baycrest, but it's with the ECHO program. It's a ministry-funded educational program for those of us working in long-term care and with the geriatric people.
That would be very good.
And that particular doctor who's presenting is very clear.
That
Very
would be
good.
Yeah.
So how do you alleviate the patient? I am still asking the same question. If you don't have the medication and you're not suctioning, and you cannot
You
put the-
give the furosemide, because if they're going to have that much congestion, it is more likely related to the collection of fluid, you know, as part of the disease entity itself.
And the furosemide you didn't say was on back order. It was the other.
No, it's not
Yeah.
on back order.
Yeah.
The drugs that are on that are going to be scarce is midazolam and nazenan. So what they're really proposing, and what this presentation is all about, is how to do your end-of-life order set for somebody with COVID that takes into consideration this potential shortage of the drugs that we tend to use. Okay, so it's
Okay,
well
that's
worth
very
watching.
helpful. Yeah, okay. And you sent the link to Kyle, or you will?
I will send it right after
Oh,
this
thanks.
conference. I haven't sent it.
Okay.
The other
thank
one,
you.
if you're looking for information on potential drug shortages, the HPCO and the OMA have done a video webinar on potential drug shortages. And it's worth watching. It does create some confusion because there's a little bit of variance between what the doctor and Baycrest puts forth versus what some of the acute care physicians or ICU physicians are putting forth. But it's a good knowledge base to have. They're really saying that our end-of-life order sets should not be based on having midazolam or nazenan available.
Okay. Because they're short. Okay.
Yeah.
Oh,
And I
very
could send
good.
you my draft. I'm working on a draft and order.
That would be
End of
fantastic.
life order sheet. It is specific to COVID. So there's certain things that what we normally do in palliating, say, somebody with advanced COPD is different than managing the dyspnea in a COVID patient.
Great. Okay, that's very helpful. We'll look forward to receiving that. Okay, where were we, Heather, in the round table here?
Well, I think we were looking at a lot of these questions here, but let me just,
I
is
think
there
we
anything else? I think the
pretty much
questions or
got them
comments in the
all.
chat, I think, are responding to each other.
Mhm.
So let me just see
And
here.
people are seeing it though?
Yeah,
Heather?
I think they
Yeah.
should be able to see it. We've talked about testing, the public health tests for COVID specifically, but also for other respiratory viruses. So while they're doing the tests, they're screening for testing for everything with the swab. And they're testing symptomatic residents, but also all of the roommates, particularly with older homes where they've got multiple people in the same room. Just some definitions of outbreak. Kyle sent the link to the PPE leads. And Claudia, again, is just saying that the challenge of not knowing the results from the staff in their particular home because they're going independently to get the testing done and not having a good sense of what their actual test status is and or when the results should be due back.
Heather, I just posted some information.
Yeah, I see that. Yeah, yeah.
Oh, yes, yes. Thank you. That's from Shyla. Yes, excellent.
Yeah. Okay, so let's go to I'm going to go back to the list of participants. And Hudo, we've had you on the call before. Just want to see if you have any questions or comments.
I do not have any questions, but I have a comment to make. And I'm hearing Doris saying she's going to be doing something with mental health.
Not me, it's Moran. Kimberly Moran is submitting something, mental Health in Children. She's the CEO of the association.
Mhm.
Oh, okay.
Yeah.
Because some of the mental health interest group individuals are looking for ways to help if needed.
Yeah, I know, but she runs the entire association. So we are
Okay.
going to have her submission, and then you guys can review her submission and give us comments later on.
Okay.
Yeah, she asked me because she needs to move some things ahead that are not moving.
Okay.
Things get in my report, somehow, sometimes things start to move faster.
Excellent.
There you go. Okay, Janice McCutcheon, I think, is next, and I think she had a comment in the chat if I can find it. But Janice, if you're on the line and you're able to unmute
Now,
yourself.
sorry, Heather. I wonder if Hudo and her group have seen what you guys developed for mental health supports, because you could
We
send
could
them
certainly
that
send it.
also, and they may add
Sure, I'll
things.
send. Yep, we can send that along. Things are changing so quickly, Doris, that new resources are coming up all the time. So we could certainly do that to the Mental Health Nurses Interest Group.
Fantastic.
And I think Janice said that she didn't have any questions or comments, but she has no outbreak in the 2 facilities in which she's working, which is good news. And Jean, we've heard from you, but have you got any questions or comments that you wanted to bring forward in terms of to be able to share with the rest of the group in addition to what you've already shared?
Jean? Don't know what's happened.
Hi,
with,
can you hear me?
Yes.
Yeah,
perfect.
go ahead. We can now.
Okay.
Yeah.
See, I have 2 different buttons for muting and unmuting, so I'm a lost cause. No, I have nothing to add. I'm willing to share with others my draft on the end of life order set for the geriatric person.
That's great. And then we can absolutely share it. We've been working closely with Jean to follow up on some of her suggestions from last week. So the team's got a poster related to helping support personal support workers in knowing how to support residents with breathlessness or shortness of breath. And so that just got finalized today. So it's with me right now, but thanks, Jean, very much for your support of our team.
And then it can go out then soon?
It most certainly will. Yep.
Fantastic.
And I just
Then
want to
Heather,
give kudos for all those hardworking staff at the bedside. They've been phenomenal, really
That's
phenomenal.
Yes.
Jean sent me a note. We have a new feature in the website that is called Thank a Health Professional.
Oh, yes. That's so lovely.
Yeah, today I said, I keep enjoying all those notes. I think everybody else needs to enjoy them. So Jean sent a note and it will be posted with your name to your staff. And Heather, if you can send me that poster today, because tomorrow I'm writing this piece, right?
Yep.
And fantastic.
Beautiful. Yeah.
Okay. Let me go back. I see a question here. I heard that persons who received trivalent flu vaccine maybe show false negative results. Any truth to this? This is from Claudia.
No, there was a lot of discussion about the flu vaccine. And all along, as far as I know, it's good to get the flu vaccine because it's good to get the flu vaccine, and especially for older persons, and not to get more complicated than what they are already. But I don't think it alleviates much or anything on COVID. There is no research as far as I know on that.
It's not really alleviating. I think she's just saying, do you think it might show false negative results? But I don't know.
I don't know if there is any link to the flu vaccine, no.
Yeah.
What we know is that 25 to 30% of the false negatives are false negatives, but it's unclear what or who. Or remember, also there are a lot of things that we don't test, that we don't, I don't know if we don't collect or we don't disclose. I'm not sure which one is the one. For example, any of the social determinants of health, in general, I'm speaking, right? Gender, race, ethnicity, socioeconomic status, we are not disclosing that to this point. In the US they are, right? And we know, for example, that racialized communities are much at risk, and other communities. So, but I haven't heard anything about the flu vaccine, and if that really alleviates anything. I don't think so. But if anybody has, let us know. Has anybody heard any of that?
Hi, Doris, it's Heather Woodbeck. Just to follow up, I was just on the Public Health Ontario website, and they have a section called What We Know So Far About COVID-19. And so they have different updates published there. They don't have anything on vaccines, just like you said, there's nothing published, but this is a place you might want to send your question.
And it is, I wouldn't send the question, guys. I wouldn't, not as an NP, because the answer will be no. And I wouldn't send that question, Heather. Because it has been discussed a lot in the media by different epidemiologists, etc. From the beginning to this day. I can assure you that if something will come, it will be, But that website is in the report, so you can look. All the websites are there. In fact, now we did the site. If you go to the site of the COVID in the website, it's fantastic. Madison really has
so Arneo's website's been restructured.
Yes, to be the word escaped me, but it's a whole site in itself.
A portal.
A portal. Thank you, Majid. A fantastic portal. It really is good, and it's going to become better and better.
Yeah, Doris, we have the slides ready. If you want to just talk a little bit about that now.
Sure. I just enjoy the conversation of my colleagues on clinical issues. I miss the clinical issues, that's why. So the portal, what happened is the same as I found myself with a lot of more and more pages on my report, that one day I said, okay, this is too much. And we transform it into a blog. The same happened with our website. There is so much richness. Quite frankly, no other association except of government has the richness that Areneo has. And hence why on Wednesday we are doing a webinar for Nursing Now that asked us to do a webinar. By the way, Heather, now they ask a second one already in Spanish. So I'm organizing several countries, will be interesting. So we organize the portal in a way that actually will be easy for people to find the things. So basic resources and guidance, then press room, anything that has been in the press that we have been involved. The next one, if you can scroll down, Kyle, and Kyle, I have seen that you are answering to people about the resources that they're asking. So thank you, Kyle, that's fantastic. Then the next, the page is there.
No, he's just sharing his, he's sharing the website rather than the slide.
The next one is Together We Can Do It. In that Together We Can Do It, we will have two sections. One is cheer for healthcare workers, and is, the tweets and the 7:30 p.m. that we do every day. And the other one will be Thank a Health Professional. And that's where we will post in your little note. Now, don't write 5 pages, please, but write a nice little note with your name. And imagine how police staff will be to see that you are thanking them, right? So that's beautiful. Then we have the blog. And then after the blog, we have Be a Nurse. So everything when you click there is to get nurses, RNs, and PES nursing students. And then there is support for long-term care, or the tremendous work that Heather and the long-term care coordinators and policy and you guys, including Jean and others, that you guys have been involved. Then there is the COVID daily situational reports. These are the situational reports that go, 1 second, Kyle, that government sends out. So those are those. The Together We Can Do It, I already spoke. And then mental health and well-being. And go there, Hudo, and tell us if you think more things could be added that are evidence-based, please. Okay, so not whatever that was found, but solid things that could be helpful. And we will continue to build it, and this is not going to go away. Number one, because Likely there will be a second round of a cluster somewhere, so we will need that again, and third cluster until there is a vaccine. And the day that is a vaccine, we will do clap, clap, clap. No more portal or portal go into dormant place or whatever. But it will be a good historical place for RNO in terms of the tremendous work that the association and all of you have put forward. So, you know, in that thank you note, I would suggest that as much as you will thank your staff in your organizations, that you also thank one another. We certainly will, because I think that nurse practitioners in long-term care have really, and not only in long-term care, I hear the same in rehab, I hear the same in the hospitals, but you guys in long-term care, in my view, have it a lot tougher because of the conditions of staffing in long-term care. So let's make sure that also we rah-rah all of you together. So maybe at the end, Heather, when we do the clap, 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 we can say thanking nurse practitioners. Maybe Kyle at the end can put a thing that says thanking long-term care nurse practitioners, Kyle, and that can be the first slide that we give to Madison to put in the LTC. Thank you. Excellent. Let's go back to questions that people had or comments.
Okay, so let me see if I can find that again and where we got to. So we've got a number of comments in the chat box, but let me just I think we only got a few more people to hear from. Joanne, you made some comments related to the testing in Public Health Ontario, but just wondering, do you have anything else that you'd like to share or comment on?
No, my only comment is I do work at both in 2 homes. So I'm continuing to do that. There's no outbreak and very few cases in the community, and it's been deemed. So we're just watching day by day what the situation is like. But for now, we're staying statu quo, but I'm only working 1 place per day.
That's great.
Okay. Kimberly's iPad is the next person. So Kimberly, I'm not sure of your last name, but Kimberly, if you can take yourself off mute if you're able, and let us know if you have any questions or comments. Or put it in the chat if that's difficult to do. And I don't see Kimberly. Oh, yep, you're off of mute, Kimberly. So let's see if we can hear you.
Okay.
Yeah, you can. Great.
Hi. So yeah, we've had a couple. We are in outbreak with 2 residents. Roommates are isolated along with them, and they were all tested as well. So we have no COVID. But I just want to say that Shannon is from the same home, so she does want to talk about something. If I can.
Yep, absolutely. Because Shannon was my next on my list. So please, Shannon, go ahead.
Perfect.
Actually, I don't see Shannon's name on here anymore.
I see her. Yeah, she's right below Kyle. Yeah, Shannon, are you unmuted?
Yes, Shannon's line is unmuted, so just feel free to speak up, Shannon.
Lots of suspense, Shannon.
Or right in the chat box.
No, she's muted again.
Oh.
Okay, Shannon, you're unmuted right now. So if,
No, she's muted. Yeah, okay, you're okay right now is when you can talk, Shannon.
Oh dear, I think
Shannon's
maybe
it goes back and forth. I know some people have been having.
Okay, well.
Hi, it's Kim again. Sorry, I'm not sure if you're.
Oh, here we go.
Oh, no one can hear her. Can you write in the chat box, Shannon?
And we'll give you some time to do
that.
that.
Yeah.
I wonder if it is.
We would like to talk about.
Go
sorry.
ahead, Kim. Go
I'd
ahead,
like to
Kim.
talk about how people are trying to social distance their residents, as that's what we're trying to do in the home.
So you would like advice on that?
Yes. Or
Great
what other
question.
people are trying to do. We're an
For
older
homes,
home.
for
We're an
homes
older
that,
home,
for
so
homes that there is no outbreak?
we're in a respiratory outbreak with 2 residents. However, when COVID started, we have a main dining room that most residents go to from both floors. We're an older home. So now we're having all the residents on their same floor. But now we're trying to integrate residents eating in their room. But of course, with lack of staff and whatnot, it's a challenge.
Difficult.
Okay, so Jean is saying meals are being served in their rooms, so no big gatherings in one dining room.
Mm-hmm.
The question
so
is,
we're
how do you
trying.
tackle, imagine the question is, how do you tackle staffing? Remember,
Staffing,
most of these
no.
residents need help to eat.
Yeah. Jean, do you have any
Can I just
suggestions
comment?
for that? Yeah.
Yes,
Some facilities have gone to staggering, depending on the size of your dining room, you have to determine how many can be accommodated in the dining room,
yeah,
allowing for the social distancing or
that's
physical
what I would do.
distancing.
Yeah.
So they do staggered feeding times. We've also gone to serving meals in their room. And what's happened here is then everybody pitches in, recreology, physiotherapy, everybody helps
Fabulous.
portering and delivering of the trays.
The
Okay.
only thing,
So,
Jean, I would say
so
when they take the residents in the elevator, to be careful that you don't, usually they
yeah,
put so many residents together, to also be careful there.
yeah, they're not using ours is just a 2-floor facility, okay? And the dining rooms are situated with each of the units. So there's no use of elevator to get them to and from a dining room. Obviously, if that was the situation, you'd have to take that into account because you can't social distance in an elevator.
An elevator, right? We've got a lot of feedback coming into the chat box. So Joanne's saying that they've divided the dining room in 2, one side for each hallway. And they've also used the activity room and the secondary smaller dining room, and also just need more physical bodies to help, activity, help or helping, etc. And then another home, a smaller home, they've used the TV room and the front entrance as 2 extra areas to dine for residents. Nobody's using the front door anymore. So that lobby area has been used for mealtime. And then, of course, don't forget that we do have one of our initial documents that we created, resources on suggestions and strategies for isolating residents. And so there's some good tips in there. And we've already talked about the use of the elevator and making sure that we separated dining for the floors so that you can avoid that potential social distancing issue.
Oh, that's great. So I hope that's helpful, Kimberly and Shannon.
Yep, and then we've heard that Jean again is just saying that in some facilities there is a staggered approach to 4 residents in the dining room. Again, depending on the size of the dining room and how many residents are there, what's working well in terms of ensuring appropriate mealtime and, of course, support and care for the residents during meals. I'm just keeping an eye on the time. It's 25 after 6. I think we've talked or asked everybody. If I've missed anybody, I do apologize.
Can I just add something about the social distancing or physical distancing?
Sure, go ahead.
Our biggest challenge has been there's a tendency for residents to gather around the nursing stations, and they're sitting side by side. So that's been a real challenge. Also to create the awareness in staff when they see this happening, the need for them to separate residents. That's been a bigger challenge for us than the dining room issue.
Good to bring. Now, someone has said demarcation tapes used to determine where tables are placed. 1 resident at small table and 2 at 6-foot tables, hallways, TV rooms, and activity rooms used. A difficult challenge, isn't it, when some people maybe don't fully understand either.
But such creative ways.
Separated. Yeah. Oh, yes, just
Remember,
lovely.
many of the residents are in wheelchairs, so it's not as if they
Mhm.
will move by themselves, right?
Yeah,
So if it's well demarcated, right?
yeah. And the wheelchair itself can give a little bit of social distance.
Yes, yes.
Yeah. Oh. Any other questions or comments? Because I think since Doris, your session is coming at 6:45, that unless there's anything you want to highlight in
It's
particular.
do you know if Tracy is coming from Villa Colombo? She was
I don't.
invited for the next session. Do you know
I
her?
honestly, I do not know. I'm sorry,
I
Susan's
will
been
tell you,
coordinating
and I
that,
will
so I'm
tell
sorry.
my colleagues in a minute. I believe
Okay.
that Tracy accepted to come.
We have a few more messages just while you're looking about that. We've
Yeah.
got considerations. Shyla sent something, considerations for isolating.
Oh, that's
And then
our
regulatory residents and hallways, TV rooms, and dining rooms of use for those requiring full assistance.
yeah.
Yeah, and I do know that Beth, you said you wanted to provide an update from NPIG. Did you want to go ahead just while Doris is checking with Tracy?
Perfect, thank you. So just a note to all of the NPs that are on the call. If you have the NPIG, the Nurse Practitioner Interest Group, as part of your interest group, I just want to hope that you got an email with a link to join our brand new private Facebook group. And that's my hope, because it is for all NPIG members, and it is for all practicing NPs. It could be RNs that are looking to become NPs, and of course students.
Could be CEOs that are interested in NP work. You never know if I don't move to become an NP one day.
So everyone who's paid the interest group
Here you go. Here you go. That's easy. I'm just nosy. I'm just nosy. Don't worry. I don't need to. I'm just nosy. I like to be in the know. I
We
love
want
it.
you there, Doris. We want you there.
So
super. Thanks, Beth, very much for sharing that.
And
Yeah,
thank you
and-
for doing it. It's a brilliant idea.
Yeah, and Shyla has actually reminded everyone to make sure they use via nurse or your organizations to access additional staff if the distancing is causing a requirement for additional staff.
Hi, Irma Jean, it's Heather.
Mm-hmm.
I just had a question from one of the comments in the chat box, and it's around staff not having to disclose the status of their COVID testing. Like,
oh, thanks for raising that. I wasn't sure what that exactly meant. Who raised it? Was it Cindy?
I actually was under the understanding that if you were in self-isolation for 14 days, which is paid work, and that you were tested, that you need to bring your clear bill of 2 negative tests back to back.
And that's how it's handled at our facility.
Absolutely, that's the way that should be handled.
but from that comment, it's Heather again, I thought that staff don't, it sounded like staff don't have to share the results of their test.
Oh, actually,
And that wasn't public information. I was not understanding. I thought.
Well, I don't know if it needs to be public information though. You know what I mean? But the manager needs to know that she's or he is negative. Nothing is like if someone has something else, mental health issue, it's not public information, right? Like we wouldn't, I mean, the staff may not want to be everybody to know. It's up to them if they share. But I do believe that they need to bring, same as someone else when he's 14 days off needs to bring a clear bill that they can be back to work.
okay.
Yeah,
Claudia,
okay, got it.
yeah, you raised that, and I think you're saying the names are concealed for privacy.
Of
Team
course.
members and staff go outside for testing on their own. Infectious disease lead, follow up with them.
And
Yes.
I totally understand that.
Yeah.
So I don't know who, like they will mention that say 2 staff members went to get tested, but they will not say who.
That is correct.
Yes, so if it's negative, then they'll mention that, oh, these 2 persons got tested and they're cleared. But if just while they're waiting for the results, it's privacy, so they don't say the names.
And that makes complete sense to me.
Yeah.
Yeah.
No, thanks for raising that, Heather. Yeah, great.
But are they still working then? It's Heather again.
Well,
No.
that depends. So in your case, no, Claudia, but in some cases, yes, and we have raised concerns with that. That is what's called working quarantine, which RNO doesn't support or agree with, and is when someone is considered an essential worker, and in a nursing home will be everybody probably, right? Because it's so little people. That they can be working and then measuring twice a day temperature if they are without symptoms. It's not something that we support, but it's kosher for organizations to do that.
Yes.
Yeah. Well, I'm looking at the time, and it is, I guess it's 6:30, 6:31.
So I want to just make a final comment before we do the click, because we will do a picture so we can post thank you to NPs in long-term care. I want to say we did ask a week ago if to do once a week or twice. My view is that we should do twice because we always use the time very properly and we always have excellent exchange of information. We have great attendance, and to us at RNA also is very, very both inspiring and interesting, and we are here to support you. So if at some point you think we need less, tell us, but we will keep going. I need to bring my my machinery.
I keep mine by my desk. It's my metal measuring cups because it's easy to manage and they make a lot of noise, but they're a bit dented now actually. So we'll do this then, Kyle, and we'll take a picture if we can, and then.
So everybody needs to be unmuted, Kyle, so we can thank the NPs. And if you don't have enough spaces, put the NPs and take us away.
Yes.
NPs get the priority. Definitely.
Everyone, please turn your cameras on so that we can see you if you have one.
Wait, we need to take our camera off?
No, turn the cameras on.
On.
Yeah, on.
Okay, Imagine, why is yours off?
Oh, I thought I should turn it off.
No, Imagine, only if there was not enough space. But why is Corsita without the, why can't we see Corsita?
Oh, they're calling me out. I'm trying.
She's trying, Dora. She's trying.
Udo.
Okay.
There we go.
I don't see Udo.
Okay, that's what we want to see.
Okay, and where is wait, no, I don't see everybody. Where is Joanne? I see Joanne. And Jean is there.
And
Okay,
Kimberly's iPad.
we are all there. Okay,
Cindy.
click. Thank you to the long-term care nurse practitioners for the tremendous work that you are doing with our nursing home and your spectacular role. Thank you.
Thank you.
From RNO and from NPIG.
Thank you.
Thank you.
See you on Thursday.
Okay.
Bye-bye, all. Stay
Thank you all.
tuned for the next
Bye.
session.
Okay, bye-bye.
Bye-bye.
7.
Thank you.